You've probably heard that a green light laser prostatectomy is a more minimally invasive way of treating bothersome urinary symptoms related to an enlarged prostate. But is there something else that you're not being told about this procedure? Hi, my name is Dr. Charles Schubert. I'm a urologist and director of the prostate clinic located on the Gold Coast in Australia. And over the last 2 decades, I've performed this surgery around 2,000 times. In this video, I wanted to get into what you can really expect if you do have a green light laser prostatectomy as part of your management strategy for treating bothersome urinary symptoms. As always, if you get benefit from the video, like, subscribe, and leave a comment. Share your thoughts for others to learn also. So as a quick recap, a green light laser in essence is a more minimally invasive way of treating urinary symptoms related to an enlarged prostate. Simply put, the prostate is shaped like a donut. It sits underneath the bladder, and the outlet pipe of the bladder passes through the middle of the prostate. As we get older, the prostate grows, it causes obstruction and therefore urinary symptoms. The laser is directed to the prostate through a telescopic camera. It removes the overgrown tissue. It doesn't remove the whole prostate, but it removes the tissue which is causing the obstruction. It usually takes 45 to 60 minutes to do the procedure, and most men are catheterized overnight and discharged the next day. There will be some geographical variation depending on where you're being managed. Okay, let's now get into some of the side effects that most men or some men can experience following this procedure. Well, the most common thing that we see when the catheter comes out is, to begin with, men can have what's called dysuria, which means they have some stinging or burning, a little bit of irritation really when they pee. It can be managed simply with something called Ural, which basically is an alkalizing agent that changes the pH or the acidity of the urine and really helps with that dysuria. For the majority of men, it settles down within a few days. The other thing that men can experience is some transient hematuria. That means they can see blood in their urine. And that can be a little bit intermittent. For the majority of people, it's settled within a week or two. But if a man has a larger prostate that requires more treatment, or he goes back on blood thinners soon after the surgery, we can see that blood in the urine intermittently can be present for a few weeks. So bear that in mind if you're going through the recovery now. Look at your nuance and what you might expect. Now, it's really important to be aware that when we remove obstructing tissue, the first thing that we do see from a functional improvement is that the flow or the pressure gets better first, and that usually takes the better part of a week. Frequency and urgency, which for many men are the most annoying symptoms that they experience before we even get to surgery, they can persist for a period of time. I've spoken about this in other videos, but the frequency and urgency is related to changes in bladder function. And as a result, we need to wait for those changes or the bladder to adapt following surgery, and that can take up to around 3 months. If you'd like to be part of our growing community, please follow the link in the comment section down below and sign up to our free newsletter that comes out on a weekly basis, keeping you up to date with all aspects related to prostate health and various treatments that are available for men. Now back to the video. Sexual function changes following surgery. Well, there are two main issues. One is erectile dysfunction and the other one is ejaculatory dysfunction. Now, almost every man who has a green light laser will notice no change in his erectile function. What does change, however, is ejaculation, and the majority of men will experience what's called retrograde ejaculation. Now, for many men, this isn't a problem. For some men, however, it is of concern. Be aware of this before you agree to proceed on with a green light laser. And if it's important for you, talk to your urologist and explore other options that are far less likely to cause any changes in ejaculation, for example, such as Rezum or Urolift or iTind. Infections or UTIs after surgery, we do see in around 5% of cases. These infections are more common if men have had infections that lead up to surgery. They can also be more common if men have had a catheter or multiple catheters in the weeks or months leading into their particular surgery. The other big issue to be aware of is urinary incontinence. Crudely speaking, two types of urinary incontinence. One is called urge and the other one is stress. urge incontinence is a little more common and can affect up to around 20% of men following this treatment. Those men that are more likely to be affected are those men who have a lot of frequency or urgency or are getting caught short before surgery. Those men are at a greater risk of experiencing urgency with urge incontinence afterwards. It's also important to be aware that some men who may have diabetes and are on diabetic medication can experience more bladder irritability following surgery than those who have normal sugar levels. Stress urinary incontinence is the situation whereby a man coughs or sneezes, and there can be bruising to the muscle that keeps a man dry. And as a result of that, if there is bruising, a man can leak urine when he coughs or sneezes or exerts himself. The way that we rectify that really is by doing pelvic floor exercises to strengthen the muscle that keeps a man dry. Okay, now there's some of the more common issues that we can see. What I want to talk about now are some of the less common issues, and two of the biggest issues that we see relate to the development of scar tissue somewhere in the urinary system. Number one is the development of a urethral stricture, and that refers to the situation where there's scar tissue somewhere in the outlet pipe of the bladder that progressively narrows with time and causes occlusion of the bladder again, and many men feel as if they're developing their urinary symptoms back again the way they were before they had their surgery. It's important to note that with a green light laser, the risk of having a urethral stricture is far less than it is with a TURP or any other procedure really that uses a larger caliber instrument. For reference, it is usually a 28 French instrument that's used for a TURP and a 22.5 that's used for a green light laser. And as a result of that, there's less stretch, less potential damage to the urethra, and therefore the risk of a urethral stricture is less. The other potential site of scar tissue is at the bladder neck. The bladder neck is that area that is the junction between the bladder and the prostate, and some men can develop a bladder neck contracture. Now, this is a rare complication and happens in around 1 in 100 people who have the procedure. But in the same way that a urethral stricture develops and shows signs and symptoms really of obstruction, the same thing happens again if someone has a bladder neck contracture. The other significant thing really is what's the durability of this procedure? Well, certainly around 90% of people at 10 years, in my experience, are still happy with the outcome that they have at that time frame. So we see about 10% of men can develop recurrent BPH and therefore recurrent symptoms related to that regrowth of tissue. Now, the probability of experiencing regrowth of tissue really relates to the age of the man when he has his procedure and how big his prostate is at the time of surgery. Clearly, the larger the prostate and the younger the man, the greater the probability that someone will require retreatment at some stage in the future. So how do we reduce our risk of developing infections? Well, the first thing is to choose your surgeon wisely. And whichever procedure you elect to undergo, just make sure that your surgeon is experienced in whichever technique he or she is going to advocate and perform on you. Without doubt, across the board, the greater the experience, it does correlate with improvements in outcomes and a reduction in the probability of side effects from any treatment. The other thing is to be open and candid with your surgeon with regards to the extent of your symptoms. If we know more clearly that someone is experiencing a lot of urgency and urge incontinence before surgery, we can counsel men appropriately about what to expect following surgery. And there are different mechanisms or different approaches that we can take in the post-operative period to try to control urgency and frequency. That can include lifestyle modification, such as reducing fluid intake or moderating caffeine and alcohol, or potentially using some bladder tablets to try and allow an individual to store better and have less frequency and urgency. The other really important thing that really should go without saying is follow your post-op instructions quite closely. One of the biggest challenges that I see looking after men is intrinsically they can be very busy people and they like to get back to normal life as soon as possible. just take it easy for a couple of weeks. The sooner you get stuck into your normal physical routine, the greater the probability of experiencing more bleeding and potentially having an issue related to that. As always, if you get benefit, please subscribe to the channel, leave a comment, share your story. If you've had a green light, please share what you thought was good or bad with the audience so that we can all learn through this journey together. As always, if you want to know more about your prostate, please have a look at this video here, or alternatively, this video. Until the next time, take care of your prostate.